Welcome to Module 5. Today we'll test your skills with a set of prescription cases. I'll show you a prescription, give you a moment to think, and then explain the best answer. Let's practice reading prescriptions with a real-world mindset. Ready? Let's begin. Here's the first prescription. Furosemide 40 milligrams once daily. Take a moment. When should this medicine be taken? Answer. Furosemide is a diuretic which increases urine production. Taking it in the morning prevents nighttime urination and protects the patient's sleep quality. That's why we advise diuretics in the morning unless otherwise directed. Next case, hydrochlorothiazide 12.5 milligrams twice daily. How should you schedule these two doses? Answer. Morning and afternoon are best. Giving a second diuretic dose at night would make the patient wake up multiple times to urinate, disrupting sleep. Next, warfarin 3 milligrams once daily. What time of day should this be taken? Answer, usually around 6 p.m. Warfarin is traditionally taken in the evening because it avoids daytime food interactions with vitamin K-rich foods, and it allows faster dose adjustment if the INR test is done in the morning. That's a crucial safety practice. Here is a combination prescription, ferrous sulfate 200 milligrams daily and calcium carbonate 500 milligrams daily. Can these be taken together? Answer, no. Calcium reduces the absorption of iron. Ideally, separate them by at least 2 hours. A practical routine is calcium in the morning and iron in the evening. Next, calcium 500 milligrams plus vitamin D 300-400 units once daily. Should these be taken together or apart? Answer, together. Vitamin D3 helps with calcium absorption, so they should be taken at the same time for maximum benefit. Moving on, diclofenac sustained release 100 milligrams once daily. Why is it often given at night? Answer, pain is frequently worse in the evening, especially with arthritis or musculoskeletal pain. Taking a once-daily painkiller at night supports restful sleep and improves patient adherence. Next case, simvastatin 20 milligrams once daily. When should the patient take this statin? Answer, at night. Simvastatin is a short-acting statin that works best when cholesterol synthesis is highest, which happens during the night. That's why it should be taken at bedtime. Longer-acting statins like atorvastatin can be taken anytime, but short-acting ones should be taken at night for best results. Alendronate 70 milligrams weekly. When to take, with food or empty stomach? Answer, empty stomach, first thing in the morning, with a full glass of water, and remain upright for at least 30 minutes to avoid esophageal irritation and maximize absorption. Gliclazide 40 milligrams once daily. Before or after meals? Answer, before meals, ideally before breakfast, because it stimulates insulin release, helping to control post-meal blood sugar. Great job working through these real prescription examples. Timing can be just as important as the medicine itself to achieve safe and effective therapy. Always remember to check prescriptions for proper timing instructions and educate your patients clearly. In Module 6, we'll look at pattern of pediatric and geriatric prescribing. Make sure you subscribe and turn on notifications so you don't miss it. See you in the next module.